on that healthcare summit. What do you think is going to come of it? You were pretty snarky yourself about that today.
I don't think I was snarky.
All right, fair enough.
I think there are two things going on with it. I think it's partly a bluff on the president's part to sort of, show that he's willing to be bipartisan, but that this gang, of Republicans are not really willing to meet him halfway. They want to tear down, the two Democratic bills that have passed. I mean, that's the thing. These bills have passed Congress. They have to be reconciled, and they passed, with a supermajority in the Senate. So, I mean, that already demonstrates a lot of support for them. But yet the Republicans are not willing to sort of meet the president halfway there. They're calling on him to sort of, to trash these bills and start all over again. And I think he's going to perhaps use the summit to call them out on that in the polite way that he tends to do these things. And the other thing is that right now the House and Senate Democrats are trying to figure out how to use these complicated legislative tactics, that go into this process called reconciliation, to try to reconcile the differences between the bills that passed so that they can pass, basically a joint bill and send it to the president without having to get 60 votes to do that. And I've talked to both sides, and it's really pretty difficult to do this from a parliamentarian perspective, but they're working on it. And then there's a recess next week. And the one thing the White House probably has learned is that when there's a vacuum in the health care debate, it gives the opponents wide room to fire away at the health care initiative that the president's supporting. So I think the White House wanted to fill that gap with anything. And so why not a health care summit? So for the next 2 weeks, people like you and I and journalists and Republicans and Democrats will at least be arguing about that, and it won't be as if there's just the